Good day everyone, I'm Angel Sabadaro, a student nurse from LPUSC School of Health Sciences. And for today, I will be performing a written demonstration on the assessment of the head, the neck, eyes, ears, nose, and mouth. So prior to performing these procedures, you want to perform proper hand hygiene and don the necessary PPEs if indicated. And after this, we can now proceed to the assessment. So good day ma'am, I'm Angel Sabadaro and I will be your student nurse for today. Kindly confirm your name and degree for me.
Lily sa Balbaro, July 15, 1970.
So that is the first thing that we want to do. We have to identify our patient in order to ensure that we have the correct patient in front of us. If there are any curtains or any doors in the room, we want to close them as well in order to provide privacy. And after that, we can now proceed to explaining the purpose of the assessment to the patient. So how do you want me to call you po?
Lily.
So Ms. Lily, I am here in order to perform an assessment on your head, your neck, and other facial features in order to ensure that everything is normal. If there are any abnormalities, we are going to take note of that and prevent further complications. So anyways, how are you po pala?
I'm okay.
Okay, have you noticed any noticeable changes on your face, your head, and your neck?
No.
Any pain or discomfort?
No.
Do you have any questions for me before we begin?
No.
But if you do have, you can ask me throughout the assessment. Okay. So now we can proceed to the first part of the assessment, which is inspection. So what is the first thing that we want to inspect here? We want to inspect the head and the face for any signs of discoloration, any signs of asymmetry, or an equal distribution of facial hair. So let us do that now. Okay. So as I'm inspecting the face of my client, it seems that the color of the skin seems normal. The facial features are also symmetrical. There are no signs of skin lesions as well. And there are no signs of excessive hair growth. So everything is normal. Kindly raise your eyebrows for me. Kindly smile for me. Okay, good. So if you notice any drooping of the face, that may indicate stroke or Bell's palsy, so you'll want to take note of that. Okay, so I'm going to put my hands on your head. Will that be okay with you? Okay. So the next thing that we want to do is to palpate the skull of our client. And we do this in order to feel any signs of lumps, bumps, or depressions in the skull. Right, as I am palpating, there are no signs of bumps or depressions on the skull, so that means that everything is normal, everything is good. Okay, good. Alright, so after that, we can now cover the areas that are not going to be examined. So we have here a towel. So if there are areas which are exposed, we want to cover them in order to provide warmth and also privacy to our client. And lastly, we want to inspect the overall skin coloration of our client for any signs of jaundice, cyanosis, pallor, or erythema. But as I am inspecting, everything seems normal, so that's okay. Okay, so now let us proceed to the inspection of the eye. So the first thing that we want to inspect is the external eye structure. But before that, we want to ask our patient some questions. So Ms. Lily, have you had any trouble on your eyesight lately?
No.
Okay. Any eye injury or surgery that you went through?
No.
Okay. Any allergies?
No.
Pain or discomfort?
No.
Okay, good. So I will be inspecting your external eye structure, and this includes your eyebrows, your eyelids, your eyelashes, and also your eyeballs. Okay? Alright. So as I am inspecting the external eye structure of my client, the eyelid seems normal. There are no signs of swelling, skin lesions. Okay, and the eyelids also covers the top quarter of the iris, which is normal. There are no signs of thinning of the eyebrows or the eyelashes, which is good as well. Okay, so now we can now proceed to inspecting the conjunctiva, the sclera, and also the cornea of our client. So in inspecting the cornea of our client, we want to have the test for corneal reflex. And in order to do that, we need to grab our pen light and shine the light just in the middle of the nose of our client. Okay, so what you're trying to look for here is the spot where the light is being reflected. If the light is reflected at the same spot, that means it is normal. But if the light is reflected not at the same spot, that would be abnormal and that would already indicate strabismus, so we want to take note of that. The next thing that we want to inspect would be the conjunctiva and the sclera of our client. So here we want to take note the color of the sclera, because if the sclera turns yellowish, that would already indicate jaundice, and jaundice indicates hepatitis. So we want to take note of that to prevent further complications. We also want to take note of any swelling or edema, especially on the conjunctiva, because if there are any, that would indicate already chemosis. So we want to take note of that. Okay, so now we want to take a look of the bulbular conjunctiva of our client. And as we do this, we want to invite our client to look up as we pull the lower of her eyes downwards, and we want to invite her to look down as we pull the eyelids upwards. Now I'm going to touch your face, will that be okay? Okay. Kindly look up for me. Okay. Kindly look down. Okay. Bulbular conjunctiva seems good, so that is okay. Now let us perform the cover and uncover test. And why do we perform the cover and uncover test? This is to ensure that the alignment of the eyes of our client is all normal. If the client shows any signs of exophoria or esophoria, what are these two? Exophoria means when you move an object near the eyes of the client, the eyes moves outward. Esophoria is when the eyes moves inward. But if the alignment of the eyes of our client is all normal, it would stay still. So let us see. Okay. I'm going to put this just above your eyes and just stay still a bit. Okay, there are no signs of esophoria or exophoria, so that is okay. So now let us proceed in examining the pupils of our client. So in examining the pupils or in conducting a complete pupil assessment, we need to use the Perla pattern. So the pupils should be equal, should be round, should be reactive, should be light reacting, and the accommodation reflex is good. So let us see. Look at me for a while. Okay. So as I am inspecting the pupil of my client, it's equal, it's round. So now let us see if it's reactive and light reacting. And in doing so, we want to turn off the lights and shine a pen light on both pupils of our clients. See? What is it? Okay. Both pupils seems reactive and light reactive. So afterwards, we can now proceed to testing the pupillary convergence and the accommodation reflex of the pupils of our client. So what is pupillary convergence? That is the ability of the eye to move inwards as we move an object closer to the face. And the accommodation reflex is the ability of the eye to focus its visual attention on the object nearing the face. And as we do this, we want to grab a pen and we want to move this pen towards the face of our client and away from the face of our client. So I'm going to move this towards your face. You will just want to follow it, okay? Good. So after conducting a complete pupil assessment, we can now proceed to the red reflex test. And we need to have an ophthalmoscope in doing this test. So I have my ophthalmoscope right here. So what are we trying to look for here? We're trying to look for any signs of cataracts or opacity in the visuals of our patient. Okay. So if both eyes reflects the red light, it would be normal. But if one eye reflects the red light and the other seems a little whitish or a little bluish, that would already indicate a cataract, and we want to take note of that. So now we can now proceed to assessing the visual acuity of our patient using the Snellen chart. Okay. So I have my card right here. Kindly read the letters that you can for me, starting with the smallest letter that you can read using both eyes. Go.
PFP, POCFP, PCFP, GC,
So kindly cover your left eye with this one.
PFP, POC, PCFP,
Kindly cover your right eye.
PFP, POC,
Okay, that's good. Okay, it seems like the eyesight of my client is 20/20. It's really good. It's nice. Okay, so now we can now proceed in assessing the 6 cardinal, 6 cardinal fields of gaze of our clients. So would you just follow my finger, please? Okay. Other side. Okay. Very good. So after the assessment on the eyes, we can now proceed to the assessment on the ears. So the first thing that we want to inspect here would be the external ear structure of our client for any signs of redness, inflammation, or swelling. We also want to take note of the color and the symmetry of the ears of our client. It seems that there are no signs of discoloration or skin lesions on the ears, so that's good. Okay, so now we want to palpate the external ear going through the mastoid process of the client. I'm going to touch your face so that you can. So we want to palpate the ears going down here. What are we trying to assess here? We are trying to assess any kinds of swelling, tenderness as well. So do you feel any pain as I am touching you? Any signs of masses on the ears? That there are none, so that is good. Okay, so next thing that we need to do is to inspect the internal ear of our patient using an otoscope. So we want to pull, in an adult patient, we want to pull the ear upward and then backward. But in younger patients, we want to pull it downward and backward. Okay, upward and backward. And what are we trying to look for in here? We are trying to look for any signs of foreign bodies in the ear, any excessive cerumen or earwax that may obstruct the canal of the ears of our client. But it seems that everything is normal, so that is good. Okay. So the last thing that we need to do in the assessment of the ears would be the whisper test. Let's see. What is it again? Okay, good. So it seems like the hearing of my client is good, but if not, we can perform the Weber or the release test if there are any trouble in hearing. So after the assessment of the ears, we can now proceed to the assessment of the nose. But before that, we need to put on our gloves. So allow me to put on my gloves for a while. So after donning our gloves, the first thing that we want to inspect would be the external surface of the nose of our client. And as I'm inspecting, the color is normal. There are no signs of skin lesions. Okay, it is symmetrical, the nose is symmetrical, that's good. Okay, so the next thing that we want to do is to palpate the nose, or the external part of the nose going to the frontal and the maxillary sinuses. So I'm going to touch your face so that we'll be with you. So what are we trying to feel here? We're trying to feel for any signs of tenderness or displacement in the bones or the cartilage in the nose of our client. Do you feel any pain? Going to the frontal sinuses. Okay. Going to the maxillary sinuses. There are no tenderness at all. Okay. No swelling, so that is good. Okay, so the next thing that we want to do is to occlude the nostril of our client externally and allow her to breathe in and breathe out. So I'm going to just cover this part of your nose and then breathe in, breathe out. You have trouble in breathing. Other side, breathe in, breathe out. You have any trouble in breathing? So after that, we can now proceed to inspecting the internal part of the nose. So would you just tilt your head back? Okay. So we want to use an otoscope with a nasal speculum attachment to see for any redness, any abnormal growth in the nose of our client, any presence of foreign bodies as well. Because I am inspecting, there are no signs of those, and everything is normal, so that is good. So after the assessment of the nose, we can now proceed to the assessment of the mouth. And the first thing that we want to inspect here is the temporomandibular joint of our client. So it is located just right here. Okay. Would you please open your mouth for me? Good. Close your mouth. Okay. Seems intact. Okay, now we want to inspect also the lips, the oral mucosa, the hard soft palate of our client, the gingiva, the teeth, and the salivary glands of our client. And we do this by grabbing a pen light and a thumb blade. Okay. You just sit for a while. Kindly open your mouth for me. Open your mouth. So we are trying to look for any signs of swelling or inflammation in the oral mucosa, but it seems that the oral mucosa of my client is normal, so that's good. Okay, the next thing that we want to do here is to inspect the tongue of our client. So I'm going to put this on your tongue. Just move it to the left side and also to the right side. See the tongue out. Move it to the left. Right. Okay, that's good. Good. And the last thing that we want to inspect here would be the uvula of our patient. So kindly say ah. Stick your tongue out. Okay. So let's see. We are trying to look for any signs of swelling of the uvula. Okay. Seems like there are no signs of swelling of the uvula, so that is normal. It's normal. Okay, good. So you just want to throw this. Okay, and now close your mouth. We assess or we inspect the tongue for the muscle tone and also for tenderness. And as we do that, we want to palpate the tongue of our client. But as my client is uncomfortable in palpating the tongue, I'm not going to do it. I'm just going to tell you that we have to palpate the tongue in order to assess the muscle tone of the tongue of our client. So after performing the assessment of the mouth, we need to remove our gloves, and now we can proceed to the assessment of the neck. So the first thing that we want to inspect on the assessment of the neck would be the posterior cervical lymph nodes. And as we do that, we want to start from the forehead of our client going to the posterior triangle of the neck. Let me just sanitize my hands first. I'm going to touch your face. Will that be okay with you? Yes. Okay. So we are going to do this in a slow and circular motion. So from the forehead, going to the posterior triangle of the neck. So we are trying to assess for any tenderness. Do you feel any pain? Do you feel any pain? Then you want to palpate as well in front of the ears. Okay, using a small circular motion. Back of the ears. On the chin. To the anterior triangle of the neck. After that, okay, we want to palpate the left and right carotid arteries of our client one at a time. Make sure that we don't do this at the same time. If you're going to auscultate the carotid arteries of our client, use the belt of your stethoscope. There it is. After this, we also want to inspect and palpate the trachea of our client using the same motion. We're trying to look for any mass, swelling, or tenderness on the trachea. We also want to inspect and palpate the thyroid gland, and we have two approaches. We have the posterior and the anterior approach. So let me first show you the anterior approach. So let me see. If the thyroid gland is not swollen or enlarged, see the anterior approach. Okay. Posterior approach. You want to move it back. Inspect. So if you notice or if you feel any enlargement of the thyroid gland, you want to auscultate that using the belt of your stethoscope and note that. Okay, but it seems that the thyroid gland of my patient is normal. Next that we want to inspect and palpate would be the supraclavicular area of our client. So would you like to raise your shoulders like this? Okay, that is located just right here. Alright. Do you feel any pain? Any discomfort? Not at all? Alright, good. Okay, so after that, we can now invite our client. We're going to assess the movement of her neck. May I invite you to touch your chest with the use of your chin, like this. Okay. Touch your shoulder with the use of your chin. Okay. Do you find it difficult?
No.
You don't? Really?
No.
Seems like you do. Again, would you like to do it? Okay. Have you had any vaccinations lately?
Yes.
Okay, maybe that's the reason why. So my patient had vaccination lately, so the shoulder might hurt a little bit, hence she cannot reach the shoulders with the use of her chin. Okay, so kindly touch your shoulder with the use of your ears. Okay, she cannot do it properly as well because of the vaccination, am I correct?
Yes.
Okay, so I guess that's it. Can you move your head like this, the side? Let the other side, please. Tilt your head back as far as possible. Okay. Do you feel any pain or discomfort?
No.
Okay. So after that, we have assessed the movement of the neck of our patient, and she seems to find it difficult to move her neck because she had vaccinations lately, and that might affect the movement of her neck. But that's okay, that's still normal. And after that, we are now done with the assessment of the neck. So after doing all these procedures, the last thing that we have to do is to remove our PPEs, perform proper hand hygiene, document the procedures that we have performed, and also refer any abnormalities that we have found in doing the assessment to other healthcare providers for further evaluation. And after that, we are now done with the assessment.